Welcome back. In this lecture, we're going to take a look at two important fat-soluble vitamins, vitamin A and vitamin K. But I'm going to start out by telling you an example of something that happened to me early in my clinical practice. I had a lady who came into Tulane Medical Center in New Orleans complaining of long bone tenderness. It wasn't so much her joints were achy, but her bones were hurting. And she wanted to know if there was any kind of dietary reason for that. Well, as we explored it and the medical team got involved, they actually thought she had what was called hyperparathyroidism, and they scheduled her for surgery. But as we explored her diet a little bit more, we discovered that she was taking a lot of preformed vitamin A, and she actually had vitamin A poisoning, and vitamin A poisoning was responsible for her long bone tenderness, not hyperparathyroidism. So she was able to avoid the surgeon's knife, but didn't realize it was vitamin A that got her there, and we stopped the supplement and the pain went away. Well, vitamin A and vitamin K are two very important fat-soluble vitamins, and as such, fat-soluble vitamins are much more likely to be toxic. Vitamin A in its role, however, is particularly important for normal and healthy vision. Deficiencies of vitamin A in the United States are not common. However, up to 500,000 children each year in developing countries, particularly in Africa and Southeast Asia, become blind as a consequence of vitamin A deficiency. Its partner vitamin K was first discovered in 1929. A Danish scientist by the name of Henrik Dam was researching the role and nature of cholesterol by feeding chickens a cholesterol-free diet. After a few weeks, the chickens on this diet started developing hemorrhages and they were bleeding. Well, he couldn't repair these deficiencies by supplementing their diets with purified cholesterol. So it appeared that a second compound, together with cholesterol, had also been extracted from the diet, and this was thought to be responsible for the coagulation of blood. Because the study was published in a German magazine, and coagulation in German is spelled with a K, the mysterious compound was named vitamin K. Although both vitamin A and K have traditional roles, the term multitasker applies to both as they have many roles in human nutrition. So you might be familiar with vitamin K and coagulation and vitamin A and vision. However, they are multitaskers. Vitamin A is indeed a great multitasker and plays a wide variety of activities in the body, including vision. It is a necessary constituent to the visual pigment rhodopsin, which is found in the rods. These are necessary to see black and white, as well as for you to see during the night. It's also important in gene transcription. It's important in making DNA and RNA. And these are necessary steps for ultimately synthesizing proteins that we need. Vitamin A also is a conductor. It teaches cells what they should become. This is known as cell differentiation. This is really important in clinical nutrition because cells need to know which direction they need to go in. And epithelial cells, skin cells, normally produce mucus that lubricates and prevents the thickening of skin. Thickening of skin is called keratinization. It's also needed for T lymphocytes, which are central to the immune system. So when we look at immune function, vitamin A protects the immune system via its role in epithelial cell development. As these skin cells line the intestinal tract, if they become keratinized and thick and crack, it allows bacteria to do what's called translocate. What this means is that we normally eat a lot of bacteria in our food. It could be on our hands. And if the intestinal cell is doing what it should, if those cells are differentiated, they don't become keratinized, they don't become thick, and they protect you from bacterial invasion. So without vitamin A, as that becomes thick and keratinized, the skin cells crack and it allows the bacteria to translocate from the gut into the blood where they can make you ill. Vitamin A is also needed in normal embryonic development and reproduction. Now, both vitamin A deficiency and toxicity can affect fetal development, and that is very important because, again, remember, vitamin A is a fat-soluble vitamin, and too much of a good thing is not a good thing. Well, as early as 1937, research suggested that vitamin A deficiency in early pregnancy increased the risk of fetal deaths. This is linked with cell differentiation and the inability of these cells to become what they are genetically predetermined to be. Vitamin A is also important in bone metabolism, growth and development of bones. It's also needed for hematopoiesis, which is the formation of blood components. Well, certainly in that skin health, we've already explored that a little bit. It is necessary for the maintenance of normal epithelial cells. In dermatology, a form of retinol is oftentimes the most effective treatment for certain types of acne. What's going on here is you apply it to the skin and it helps the new developing cells to become healthy, to do the normal role of epithelial cells. There's also some emerging role for vitamin A in reducing the risk of heart disease, but that's in its infancy. Vitamin A also has antioxidant activity. Now remember, antioxidant means it protects cell membranes from oxidative damage. Well, as in all forms of human nutrition, we have to take a look at the bioavailability of a compound. And with vitamin A, there are 3 different forms of vitamin A. Retinol is an active type of vitamin A, and it's found in predominantly animal foods. Things like liver, great source of vitamin A, whole milk, it's in the fatty portion, butter, eggs, cheese, and some fortified foods have retinol added to them. Keep in mind though, because it is a preformed vitamin A, it is much more likely to be toxic. Retinol and its 2 other cousins, retinal and retinoic acid, are what are considered the preformed or the most active form, the most biologically available form of vitamin A. Protein is required to transport this fatty compound in blood. Keep in mind, oil and water don't mix, and retinol and its cousins need what is called retinol binding protein to take that fatty compound and store it in the liver. And about 90% of vitamin A is actually stored in the liver. Think about that. Makes sense. If animal liver is a good source of vitamin A, we store it as human beings in our liver as well. Carotenoids, such as beta-carotene, probably the most popular, are considered inactive forms of vitamin A. Now that doesn't mean that they can't become vitamin A, but in their infancy, they are considered provitamins or precursors for this vitamin. Now they can be converted to vitamin A in the body, but there's an important distinction here. They actually have to be converted from beta-carotene on to the biologically active forms, and in our body we have breaks, we have rate-limiting steps to prevent beta-carotene from becoming retinol if the body doesn't require it. Well, we have about 600 carotenoids in food, but about 50 to 60 are found in the human diet, and fewer than this have vitamin A activity. Carotenoids, because they are precursors to vitamin A, are relatively non-toxic. The brakes can be put on if the body has enough retinol. Now this is important. The absorption of provitamins like beta-carotene depend greatly on the amount of lipid or fat that's ingested with the provitamin. Fat in the diet actually increases the absorption. So you might have remembered a few years ago when low-fat or fat-free diets were the craze and everybody was counting their grams of fat. Think about that for a second. What that actually did was reduce the absorption of beta-carotene or carotenoids from the diet. Carotenoids are found in plant sources, such as green leafy vegetables, and probably the most popular is carrots. So you remember when your mother told you to eat your carrots because that's going to help your vision? Actually, what your mom didn't know is carrots don't have any preformed vitamin A, but they have carotenoids which can be converted to vitamin A. Lutein and lycopene are carotenoids that have no vitamin A activity. They're not going to convert to vitamin A, but they are still beneficial. Lutein is kind of in the yellow-green pigment, and lycopene is in the red pigment, tomatoes, watermelon, things such as that. Additional roles for these carotenoids might be in the prevention of macular degeneration, an eye disease that we get with advancing age, and the prevention of prostate cancer. So now you can actually find supplements on the market that will say that they have lutein or lycopene added for the prevention of those 2 chronic diseases. But keep in mind, anything that causes fat malabsorption can cause a reduction of absorbed carotenoids. Now that would include laxatives, so anyone who's chronically using laxatives, or there's a new product on the market for weight loss called Ally. And actually what Ally does is cause, as part of its design, it causes fat malabsorption. So as such, this medication will increase the likelihood of malabsorbing or not absorbing carotenoids. Well, the big question remains, are carotenoids essential? Well, yes, as they're needed for the precursors of vitamin A, but they're not considered essential nutrients on their own, independent of their vitamin A activity, according to the National Academy of Sciences as recently as the year 2000. But as a group, these carotenoids function as antioxidants. Now that could be good and bad, and we're going to explore that in a little bit more detail. Multiple intervention studies have tested this role. Now keep in mind, in the research studies, they're looking at beta-carotene as a supplement, not as a food. And the AT-BC Cancer Prevention Study, which stands for alpha-tocopherol, vitamin E, beta-carotene, precursor to vitamin A. They looked at 30,000 people between the ages of 50 and 69. And the unfortunate thing is those in the beta-carotene supplemented group died with an increased frequency from lung cancer, heart disease, and stroke. The CARROT study saw an increase in mortality in heavy smokers and those exposed to asbestos in those that were getting beta-carotene. Current research indicates that beta-carotene supplements can cause oxidative DNA damage in lung epithelial cells, and this might be the etiology of the increased mortality. So keep in mind there's a difference between the amount that you could actually get in a normal diet and what you would take as a supplement. Additionally, beta-carotene as a supplement is associated with increased heart disease risk and a possible increase in gastrointestinal cancer. What foods contain beta-carotene? Well, a half a cup of carrots, cooked from fresh, has about 671 micrograms. 3/4 of a cup of carrot juice, over 1,600 micrograms. A medium sweet potato baked with the peel, over 1,000 micrograms. And 1/4 of a medium cantaloupe, which would be raw, 230 micrograms. Okay, now I want you to think about this for a second. These are going to be in amounts smaller than in those studies. So again, when it's put in the food naturally, the amount is going to be within a therapeutic range, if you want to think about it that way. When you take it as a supplement, you're going to take oftentimes above and beyond that. Well, how much vitamin A do you actually need? Well, these are RDA values in grams per day or micrograms per day. Males, 19 to 70, require about 900 micrograms. Females, 19 to 70, 700 micrograms. Easily met, very easily met with a normal diet. Well, deficiencies of preformed vitamin A. A vitamin A deficiency can occur from inadequate dietary intake or secondary from the malabsorption of lipids, which we've already explored in some degree. But states of illness that might cause malabsorption of fat, very, very low fat diets, certain lipid lowering medications, some of the statin resins can have an impact on vitamin A status. Problems with bile, and remember what bile does, bile keeps oil and water mixed together. It emulsifies those so the fat can be better absorbed. So problems with bile production, malabsorption of fat can lead to malabsorption of vitamin A. Or from chronic exposure to oxidants like cigarette smoke. Well, the following health problems, especially with vision, may result from a deficiency. Reduced night vision, the inability to correct your vision when you go from a light room to a dark room, or most probably importantly, from your lighted home onto the road when you're driving at night. If it goes on, it can cause night blindness. It's also a cause of dry eyes or eye inflammation. There's a condition also known as Bytose spots, which are superficial white or gray patches occurring on the eye membrane due to deficiency in vitamin A. So oftentimes in developing countries, when individuals go in and do public relief in developing countries where children are more likely to have a vitamin A deficiency, Bytose spots are one of the first things that they can assess to see whether or not that child is developing a vitamin A deficiency. A deficiency of vitamin A contributes to the high prevalence of measles seen in developing countries. Now, why would that be? Keep in mind that if you have a vitamin A deficiency, you get a keratinization of the GI tract, and when it becomes keratinized, bacteria, viruses can translocate. According to the World Health Organization, 100 to 140 million children suffer from a vitamin A deficiency. This deficiency makes vitamin A blindness one of the leading causes of blindness in children worldwide. Now, I'll tell you, in my clinical practice, the only time I've ever seen a vitamin A deficiency is going to be in someone who's recently immigrated from a foreign country, and I have seen that. I had a nursing student when I taught at the University of Texas whose whole family went blind from a vitamin A deficiency, and when she saw pictures in my class and slides in my class, she knew exactly what it was. She was living in Africa during the time of a massive famine when fruits and vegetables, as well as animal sources of vitamin A, were in short supply. Now, the excess of preformed vitamin A. This is a challenge because there's a narrow range of essential and toxicity, which is generally about 10 times the RDA. The tolerable upper limit is about 3,000 micrograms per day, or about 10,000 international units. And usually what you'll see is on a supplement bottle, it will tell you how many international units are available in that product. We haven't quite in the United States made the transition between micrograms and IUs. 20,000 international units during pregnancy can cause birth defects and spontaneous abortion. The most notable birth defects in pregnancy are going to be cardiac birth defects. And so that is one of the reasons why the formulations of prenatal vitamins have changed in the years past. In the years past, there used to be only retinol, the active vitamin A, in prenatal vitamins. And now they've removed some of that and they've replaced it with beta-carotene. Certainly you can have blurred vision, and just like my woman at Tulane, painful swelling of the long bones like the femur of the leg. There can be swelling of breast tissue in men called gynecomastia. However, the major cause of gynecomastia in the United States in men is going to be obesity. Impotence and other sexual dysfunction can also occur with a level of vitamin A that's outside of the therapeutic range. There can be calcium loss in bones that can lead to osteoporosis. And then these kind of vague symptoms of irritability, nausea, headache, fatigue, dizziness, and diarrhea. Certainly skin and hair changes, skin peeling, itching, oily skin, hair loss, cracks at the corners of the mouth. And in infants, an abnormal softening of the skull bone and poor weight gain. Now, other consequences, and this is particularly of beta-carotene, is going to be, again, a little bit different than the preformed vitamin A, much less likely to be toxic. But too much beta-carotene can actually cause yellow-orange skin. I had a client one time who absolutely loved carrots and felt that he needed to have adequate amounts of carrots every day, and he ate bags of carrots. And you could look at the palms of his hands and the soles of his feet, and they actually had a nice orange glow to them. Certainly in the early days of sun tanning pills, they had high-dose beta-carotene in them, again, as a way of turning your skin yellow-orange, maybe not the look you were going for, but it still gave you this nice glow to your skin. But now we come to the other multitasker, vitamin K, oftentimes known as the master coagulator. Well, the bioavailability, and there's that term again, there are two primary different forms of vitamin K. Phyloquinone, vitamin K1, comes from plants. The word phylo means plants. Menaquinone, also known as vitamin K2, comes from animals, and specifically the bacteria in the gut, which makes a really true requirement difficult to set. So in other words, we can't tell how much the gut produces. And so we really can't tell anyone how much we require from outside sources. So the bacteria in our gut make a lot of vitamin K. There's also a synthetic form, also known as vitamin K3. So we've got our three major forms, two primary, with vitamin K3 bringing up the rear. So what is the function of vitamin K? Well, remember, it comes from that German word coagulation and is needed for the normal clotting cascade of blood via the synthesis of blood proteins. Vitamin K is also needed for the production of what are known as GLA proteins, which are needed for the normal bone protein. So as you look at some of the supplements on the market now, they're actually saying vitamin K is added for the development of healthy bone. Osteocalcin is needed for bone remodeling. Increasing evidence that vitamin K may aid in the prevention of osteoporosis. It forms a matrix protein which is found in cartilage. And so matrix protein provides the framework on which bone is formed. Well, what food sources contain vitamin K? Well, kale, not terribly popular in Texas where I'm from. Spinach, where the bioavailability is better cooked than raw. Cabbage, broccoli, Brussels sprouts are all going to be great sources of vitamin K. Again, the requirement, there is no true requirement because we don't know how much the gut produces. But when no RDA exists, there is compelling evidence to set a requirement, and the National Academy of Sciences sets an acceptable intake, or an AI. The current AI for women is 90 micrograms and 129 micrograms for men. So women 90, men 120. Well, what about the deficiency in the excess of vitamin K? Vitamin K deficiencies are common among the following populations. Breastfed infants, because breast milk is low in vitamin K. Neonatal infants, because the mother's placenta transmits lipids and vitamin K relatively poorly, not great transfer across the placenta. And babies are born with a sterile gut. They have no real bacteria. The bacteria comes from the outside. So since bacteria produces vitamin K, newborns are usually given 1 milligram of injection at birth. So I think the key thing is, if a baby's going to be born at home, you really need to make sure that that baby goes to a physician relatively early and gets a vitamin K injection to prevent a poor clotting outcome. Well, what about drug interactions? Most notably, vitamin K can interfere with anticoagulant and antiplatelet drugs. Most importantly, antibiotics kill the bacteria that can make vitamin K. So anybody taking chronic antibiotic therapy is going to be unable to synthesize vitamin K from the bacteria in the gut. Well, the great news is there really is no known toxicity of vitamin K. Now, therapeutic doses can be prescribed to reverse the anticoagulant effects of warfarin or some of the other anti-clotting drugs. Most patients on anticoagulant therapy are asked to keep vitamin K intake consistent. So what does that mean? What does it mean to say I'm going to keep my vitamin A intake consistent? Well, that means that you wouldn't eat a lot of broccoli one day and then none the next. So you're going to have to make sure that if you're on any of these anticoagulant drugs, that you're really working hard to have a source of vitamin K every single day to make sure that you're not having a lot one day and none the next. Physicians get a little bit unnerved when clotting times come back a little bit off kilter. So if you're on one of those medications, make sure that you keep your vitamin K intake consistent. It's also important that when you're trying to keep that vitamin K intake consistent, that you check your multivitamin that you might be taking. So again, if you're taking one with vitamin K every single day and then you go on vacation and forget it for a week or two, you're not keeping your vitamin K intake consistent. Now, frequently asked questions. I always hear, I'm disturbed to hear about the negative outcomes of studies that you mentioned and the bad side effects of too much beta-carotene. Well, what happens if I snack on carrots all the time? Is it harmful? Well, here's the key. Keep in mind that the intervention studies that are designed to test the effectiveness or the toxicity of a supplement must always use a supplement and not real food. Why? Because they have to keep the beta-carotene consistent or try and keep it consistent. So I think the challenge is there is a difference between beta-carotene that you would get in your diet and beta-carotene that you would take as a supplement. So some of the intervention studies that I mentioned may have up to 25,000 micrograms of beta-carotene. So I think the challenge is you're unlikely to have an adverse reaction from eating carrots. You're unlikely to have an adverse reaction of lycopene and lutein from a food, but more likely to have an adverse outcome when it becomes a supplement and when the dose is high. I'm pretty fond of saying that human bodies like to drive down the middle of the road, and when we start taking them in one direction or the other, we're actually living in the ditch. So the bottom line here is you're not going to have an adverse outcome from food, but from supplements, absolutely. Now, another frequently asked question. What did people do before babies were given an injection of vitamin K at birth? Were they more prone to bleeding? And the answer is absolutely. So again, now with a resurgence in home births or alternative birthing centers, new mothers must understand that if they're going to do that, perfectly okay to do that. If you're going to do that, make sure that you get to your healthcare provider and get an injection of vitamin K. Otherwise, an adverse reaction would be your baby's blood may not be able to clot, and it's something called hemorrhagic disease of the newborn. So again, I think it's probably pretty important. Well, then the companion question is, oh my goodness, if newborns are given shots of vitamin K, shouldn't my baby have follow-up injections? The answer is no. And the reason the answer is no is once the baby starts to nurse or drink from a bottle, there is going to be an auto-population. We're going to start to have bacterial growth in the gut, and some of that is going to be very friendly bacteria, particularly if that baby's being breastfed. So there really isn't a need for follow-up injections, nor, probably more importantly, nor is there a need for a mom or a dad to start to think, oh my goodness, I'm going to have to go get my baby vitamin K supplements in order to prevent hemorrhagic disease of the newborn. And the answer is you don't have to do that either. Okay? Now, following along those lines, my daughter is breastfeeding her baby. Shouldn't she take extra vitamin K? And the answer is no, she doesn't need to. Again, keep in mind that you have 3 different forms of vitamin K. One form is going to be from plants, so everybody should eat a plant-based diet called phyloquinone. The other is going to be menaquinone made by the bacteria in her gut, as well as now her baby's gut. And the third is going to be a vitamin K from supplements. So the bottom line is you don't need to do that. However, it is important for that breastfeeding mom to keep in mind that in order to protect her own bones, she should have a source of vitamin K absolutely every single day within her diet. And thank you very much.